Dr. Claytor here with my latest version of best pathways to beat COVID-19. Relatively straightforward. Testing, testing, testing. So we all know that for several weeks and months now, across the entire world, we've been testing for the presence of the virus by culturing or swabbing the posterior nares. What we were looking for is detecting the RNA through a technique called RT-PCR, which stands for reverse transcription polymerase chain reaction. Big fancy word. Basically what it means is if we see that RNA of the virus there, it binds to it and demonstrates that it's in fact present. Doesn't actually tell us whether or not that person's really going to get sick or they're going to resolve without any sequela. All it does is tell us whether or not the virus is there at that one moment. Where we're moving, and where I really want to spend some time describing the new testing, is for the presence of antibodies. So these are called serology tests, and there are three main types. The first type is a RDT, or a rapid diagnostic test. That's something that you may come out and see on a little card. A pinprick, blood goes in there, and a line will turn positive or negative. Very similar to how a pregnancy test would be done. Unfortunately, with this, it doesn't tell you too much about the antibodies that are there, the level of antibodies, or even whether or not these antibodies will protect you in the future. They just tell you that those antibodies happen to be there and that you have more likely than not developed them because of exposure to the virus. The next test is the ELISA test, which stands for Enzyme-Linked Immunosorbent Assay Test, and this is more sensitive. It takes longer. It takes 1 to 5 hours, whereas this is just a few minutes. And this will actually give you much more information, titers, levels, amounts of that antibody, and a little bit more specificity for it, which is more information, gives you a better idea of the strength of those antibodies. The final test is the neutralization assay, and quite honestly, this will detect the presence of active antibodies in patient serum that are able to inhibit the virus growth. So obviously that is the most important of all of these tests. Unfortunately, it takes several days for that study to come back as opposed to these rapid tests. So that's the basic terminology. As we move from just testing the virus alone to testing for antibodies and looking for serology, we will be gaining more and more information about really the prevalence of this virus across our entire population and really how we can go about fighting it the best. Hopefully you found this helpful. Thanks so much.